Hello, welcome back to the channel. Look who we have back. It's everyone's favourite, Dr Sonia.
Hey Ed, good to be back.
Good to have you back.
Yes,
it's been a while.
Very long time, hasn't it?
How are you doing?
Yeah, I'm not too bad, thank you.
Good.
It's been a bit of a busy year, all around really. Still busy now, but yeah, sun's shining. That's good.
Well, that's what I wanted to talk about. In terms of the year, it's been a year of unknowns, hasn't it? Every stage we're at. Where are we at right now?
I think we're quite firmly in wave 3. I think there's a bit of a perception out there that because it's summer and holiday season that COVID's not really a problem anymore.
And the lockdown's very much...
Yeah, that's kind of a thing of the past, and everyone's vaccinated or not, and therefore it's all gone away, hasn't it? No. Obviously
now we're at a position where sort of 40 million people have had their 2 doses of vaccination. So we're seeing a change in really the numbers we're seeing and the type of patients we're seeing. But so how's it like on ICU at the moment?
It's very difficult actually, I think across the whole country. About 20% of the ICU beds in the UK are currently filled with COVID patients. Okay. So it doesn't sound like a lot, but ICU beds run at capacity pretty much all year round. And I'm only talking from the ICU perspective, but it's the same on the wards. So if you take a system that normally runs at capacity and try and add the 20% that COVID's adding to it, it's really straining the system, really straining the system. The only reason that we coped with the first and the second waves were because we stopped other activity. This time around, we're trying so hard to not even carry on with all the other activity, but to play catch up on all of the people that were waiting to be seen in clinic or waiting for surgery. A lot of those patients who have big surgery need to come into ICU beds. So they're competing with a COVID patient who, just one COVID patient might be in an ICU bed for, say, 6 weeks. A patient having cancer surgery might be in an ICU bed for 2 days. So that one bed that's filled with a COVID patient, you might have otherwise been able to house 20 or so cancer patients in that same bed. So small numbers make a really big difference. And we're not really resourced as we were previously in terms of staff. We're back down to ICU having to deal with everything because the other staff in the hospital are very, very busy playing catch up.
I was going to say that as well. And we're entering the sort of summer period as well. Lots of staff really trying to get a chance to get their breath over the last year, but also COVID is still around, and we're still having to deal with people isolating. So I mean, are we seeing staff off with it? And
we're seeing staff off either with needing to isolate if they've been pinged or if they've got family members who've got COVID. We're seeing a fair number of staff get COVID, so even though they've had 2 jabs, luckily they seem to be getting it in quite a mild form, but there's no doubt that people that have 2 jabs are still getting COVID. And everyone pretty much for a year didn't take any annual leave. And now people are really tired and they're just trying to take their leave. So all of that together has created a little bit of a perfect storm of busy hospitals. In fact, disproportionately busy for this time of year. We would normally see a bit of a quieter period over the summer. We've not seen that this year at all. With very few staff trying to deal with it all.
Talk to me about the sort of the patients we're seeing, because obviously we know this disease disproportionately affects people with certain comorbidities and age. What are we, because they tend to be the people that are being prioritised with vaccination, are we seeing a different patient groups?
The data from the intensive care admissions shows that on average people are about 10 years younger during this wave than they were in the second wave. So whereas last time we saw plenty of young people in their 40s, 50s, we're now seeing plenty of people in their 20s, 30s, 40s and 50s, some of whom are coming through unvaccinated and they have the same severe disease that COVID always produces in people that come to my ICU. They are sick and they die. 40% of them that come to ICU are still going to die. I'm pleased to say that the vaccines do seem to be really working. The number of patients that we've seen come through is very much less than the second wave, probably a quarter or 20% of the number of cases we saw in the second wave. And almost all of them are in unvaccinated people.
Right.
In fact, I've only on our unit seen one person who was double vaccinated that we had to admit to ICU.
And there's an education piece there, isn't there? That the vaccine is helps protect you, but it's not 100% guaranteed.
No.
But it is the best way to get yourself protected. But also young people think individually your risk might be low, but with a virus still very prevalent, you're still going to get those numbers. And I think there's a bit of certainly some of the young people I've spoken to, they'll sort of say, well, I'm fit, unhealthy, I could handle it, but...
Yeah. When I ask people why they've not decided to take the jab and then come in with severe COVID, it's usually not people saying, I'm dead against having the jab. It's people saying, well, I'm young and, COVID it's not going to affect me, and if I do get it, I'll just it'll just be like a cold. Well, yeah, it will for probably 98% of young people, but there's still that very small percentage of fit, well people who go to the gym every day, who go out running, who eat sensible diets and don't smoke or drink, who are coming through, and some of them are dying of COVID.
It must be difficult. I don't know if you do this or not, but when obviously you need to know if people are vaccinated or not, but do you broach that with them and talk to them about that? And is it an opportunity to have an education piece with them, or is it just not the right time?
It's often not really the right time because they're feeling very unwell, and obviously we've got to treat them. But I do usually try and explore it a little bit, because you often find that if one person hasn't been vaccinated, then the whole household hasn't been, or their extended family. And if there is some genetic element to this, that certain people seem to get COVID more severely, and we've certainly seen family clusters, I think it is an opportunity to say to other members of the family, look, you may have thought that you weren't vulnerable here, but one of your blood relatives is in ICU with COVID. Do you want to just have another thought about the vaccine? But the thing that is difficult is myself, my colleagues, all of the staff on the ICUs and in ED and on the wards, we're having to walk into an infected zone again and again and again, and we're having to put ourselves at risk. And yes, we've got PPE, but it's not 100%, it's very good, and it decreases the transmission a lot, but there are still healthcare workers getting COVID. And I think it's fair to say that there is some anger and disappointment out there that we're having to do this for a large group of people who probably could have prevented their illness. So the first couple of waves, that of course there were no vaccine, that thought process wasn't there. But now it's like, yes, it's your personal choice not to have a vaccine, but it's not my personal choice not to treat you. I will treat anyone that comes through the doors, and I will do so without prejudice. But your personal choice not to have a vaccine affects other people.
And where do you see things going now then? Obviously, I've learnt in this pandemic that if anyone tells you they know exactly what's going to happen, you know that they're talking rubbish, because nobody really knows, right?
Yeah. I guess the big thing now is we've still got 30% of people under the age of 29 who haven't been vaccinated. There'll be a really big pool of people who will keep the transmission of COVID going and potentially pass it on to older people who are more vulnerable. And I guess for the older people, the question is, how long is the vaccine going to work for? And we don't know the answers to that yet. It may be that people that were vaccinated at the very beginning, back in December, might not have that much protection left. Or it may be that actually the protection now is as good as it was in December. We don't know. And I think anyone that tells you they know, well, probably not. I think only time will tell.
Well, I was reading about this as well, because obviously I got COVID just the other week, and I was thinking, well, I thought it was slightly more severe than I was expecting it to be, even though I've been double vaccinated. And I looked at, antibody levels drop off, but it's not as simple as that. It's not it's your immune system. Most antibodies are going to drop off over time. It's having the memory in the immune system, not just the antibodies.
To be able to kick out the antibodies again. This is the thing.
Exactly. So nobody quite knows how things are, and I wouldn't be surprised if there's some kind of booster. Later on
I think we're expecting a booster program for everyone over the age of 50 and healthcare workers, and I believe that that's due to start up later this year. Although there have been some calls, certainly from the World Health Organization, to perhaps vaccinate more of the world before we do the round of revaccinations, because again, this is a global problem. We're not really just sat here on our little island waving at all the Australians and everyone saying, hey, you should have had your vaccines by now. We have traffic coming in and out of the UK all the time. So unless we get this under control throughout the world, we're going to keep having problems in the UK.
And as many people have pointed out, the more prevalence you have, the more of a reservoir for mutations, and it's just going to prolong it. So it's not just us being nice to the world, it's selfishly within our interests as well to make sure everyone's vaccinated. In other things in life, how are things? What's the latest Lego creation?
Yes, the last thing that I built myself was an aquarium.
Okay.
Actually. Do you want
I'll cut it in now so everyone can see the aquarium.
Yeah. Yes, so still keeping up with the Lego. Unfortunately, the big Lego shows were all cancelled this year, but that's fine. There's preparations for next year's shows to be even better. We've got a couple of projects that 60 or 70 Lego enthusiasts are working on together. So there's going to be some really, really good stuff.
Is this why you had thousands of bricks delivered?
Yeah.
How many bricks?
I think, we took a delivery for the whole group of somewhere in the order of 500,000 bricks that we then had to sort out. So those will go on these collaborative projects that we're doing.
Very good. As always, thank you so much for joining us. I'm
you're
sure
very welcome.
I always get comments asking about how things are, so it's good get you back on just to show everyone that how we're doing.
Yeah, it's nice to be asked to be on the show again.